It was one of the scariest parts of my life, to be honest with you.
Chris Eastford's lungs are damaged. The 35-year-old spent 12 days being intubated in the ICU. He was just days away from being eligible for a vaccine.
I'm very disappointed with our government right now, our provincial government.
Eastford is one of over 300 people hospitalized with COVID-19 in Manitoba. 74 of them are in ICUs. So many that to free up beds, at least 10 patients have been flown to Ontario. Test positivity rates are also climbing.
Our COVID units are full and our emergency departments are backing up with patients who are on ventilators or requiring a bed in a COVID unit.
Doctors Manitoba put a survey out of their ICU and ER physicians that are right in the thick of this. 98% of them feel that the hospitals are not ready.
Manitoba has banned indoor and outdoor gatherings this long weekend with multiple households. But retail stores and malls are still open with 10% capacity. Only one shopper per home is supposed to go inside a store. Some mall employees say that's not happening.
And people are taking like their whole families. And like, you really don't need to be doing that during a pandemic.
You need the strongest restrictions at the right time. And currently we do not have that.
The Premier is directing his anger at the White House.
So I'm asking, and I hope others will do the same, that Joe Biden stops saying no and that he says yes to getting those vaccines up here.
Brian Pallister wants DC to allow Manitoba to bring up thousands of unused vaccines from North Dakota. Back in hospital, Eastford hopes by sharing his story, people might take COVID more seriously.
I would take those restrictions over having a machine breathing for me for 12 days.
And Austin, the federal government now confirming it is sending in help.
David, the feds are sending up to 50 contact tracers to help with the fight here in Manitoba. They're also sending dozens of more critical care nurses and respiratory therapists. But Premier Brian Pallister himself told me he doesn't know when that help is going to arrive. Now the question tonight is if that help will be enough. With some 5,000 active cases here in Manitoba and hundreds more being reported each day, these reinforcements are certainly going to have their work cut out for them. David?
Austin Gravish in Winnipeg, thank you. Let's turn to Dr. Anand Kumar for an insider look. He is an ICU physician at Winnipeg's Health Sciences Centre. Dr. Kumar, take us inside. What's it like in the hospital now?
Things are quite dire. We're getting more patients requiring ICU coming in than we have ICU nurses to take care of them. It's quite difficult.
There has been talk about what restrictions need to be in place to bring this under control. Do you believe the measures that currently exist will bring the outbreak under control in Manitoba?
Absolutely not. They've been in place for 2 weeks. The numbers are the same or going up in terms of daily cases and the counts that are coming into the ICU. Basically, we need a hard lockdown to get this under control.
And if you don't get one?
Then a week from now, or less than a week from now, we are not going to have a place to put patients. Ontario has already agreed to take 20 patients from ICU and transfer. We'll hit that limit within days. After that, unless they're able to open beds by bringing in additional nurses, we won't have a place to put ICU patients.
And what does that mean?
That means we'll have to be thinking about triage as one option for life support. We'll be picking who's going to get full support and who's not.
Dr. Kumar in Winnipeg, thank you.